Welcome, everyone. I can see that this is by far the biggest group we've had all day in any of our sessions. There are over 100 of you watching from home. So that's pretty cool. I know that we're going to hear some great things today. So I'm glad you're here with us. My name is Beth Freeman. I am the Career Readiness Coordinator for the Kearney School District. And I'm also a member of the Northland Education and Business Alliance, also known as NEBA. And we have come together as a group to host these sessions for you today, hoping that you can find out something about a potential career path that you might be interested in. NEBA is a network of education and business organizations in Clay and Platte counties, whose vision is to provide and promote business-driven educational opportunities for you, our next generation of business leaders. So again, we're happy that you're all here with us today. I will be the host during the session, but we also have a couple of other NEBA members here with us running the show. Natalie Barner from Park Hill School District and Amy Washam from Northwest Missouri State University. They're helping keep things moving along. Natalie will help with the question and answer board. Speaking of that, if you look at the bottom of your screen, you'll see an opportunity to post questions that you might have for our panelists. Please use that. Now, with over 100 of you watching, we definitely can't promise that we're going to get to all of those questions, but we will do our very best to get to as many as we can in this short amount of time. The session will end at 12:40, and then following this session, you will see a brief survey that we would love for you to fill out. Let us know what you learned today. Give us suggestions for future events like this. That would be really helpful to the group. So let's begin. I would like to welcome our panelists for this afternoon, Dr. Melanie Lively from Healthcare for Children and Lindsay Barnes from Kindred Hospital. What we're going to do first here is I'm going to have them give a brief introduction, give us a little bit of history on your education and business history. And then we're going to make this more like a conversation because we want you at home to be able to interact with our panelists. So be sure to use that question and answer button and let us know what you need to know to make this successful. So we'll start with Melanie. Do you want to go ahead and give us an introduction, please?
Absolutely. As you have already said, I'm Ms. Dr. Melanie. I am originally from St. Louis, Missouri. I came here for college back in 1989, so that's a little time ago. I attended the 6-year program at University of Missouri, Kansas City, did my residency at Children's Mercy Hospital, and stayed on for a chief residency year and into private practice here in Liberty. And have been there ever since. The only change has been with our business that we are now an affiliate of Children's Mercy Hospital as opposed to simply a freestanding clinic. So that's me in a nutshell, and happy to answer any more questions about any of that I can.
All right, thank you. Lindsay, would you like to do the same and give us an introduction, please?
Sure. So I'm Lindsay Barnes. I'm the Chief Clinical Officer here at Kindred Northland Hospital. It's a long-term acute care facility. I started off when I was 19 as a CNA, had no idea what I was going to do with my life, and worked up as an LPN and an RN and supervisor and all of the roles known to man. I started off with my associate's degree in nursing through a technical program and then furthered into my bachelor's degree online with Western and Governors University.
All right, thank you so much. Okay, so I'm going to hand this over to Natalie, and she's going to help guide us through the questions that are posted. So again, those of you at home, let's hear those questions that you have, and we'll do our very best to make sure that those get answered.
I was on mute, sorry. Thank you for the introductions. And for both of you, how did you decide to go into healthcare? Was it something you always wanted to do growing up? Or did you kind of fall into that? And we'll start with Dr. Lively.
When I was growing up,
She froze
I
on your
had
end.
a sick parent. My father passed away. healthcare settings. So I very much look to the doctors. When I was a child, the doctors were the good guys that came walking in and told us where things were going to go and how things were going to pan out. So that's my exposure is firsthand dealing with a sick dad.
Thank you. Lindsay?
I had zero idea what I was going to do after I graduated high school. I knew I wanted to make an impact and a difference. I couldn't sit behind a desk, and I knew I needed to make a difference. So I decided to take a CNA course and get into the hospital system. And then I realized that, nursing was the career I wanted to take.
Awesome. And then, so you have kind of both spectrums. You have long-term. So is your long-term facility, is that for more older patients, or is it any age range?
So most of our patients come from ICUs from other hospitals like AU, Truman Research. We're an intermediate hospital. So they're still very sick on ventilators, on drips, IV antibiotic wound care, things like that. So they come here for usually about a month so we can stabilize them medically. So then they can either go home with home health or to a skilled nursing facility or acute rehab.
Okay. And then Dr. Lively, did you always have a passion for, I know you said your dad was the reason why you went into it, but then you ended up in pediatrics and at Children's Mercy. So how did you end up with the younger age patients?
I love children. Mm-hmm. There's just a difference. I always looked at adult medicine when I had that experience through med school, because you kind of, when you go through med school, you experience all the different realms of medicine and you kind of get to see a little bit of each of them. And for me, adult medicine was very much caring for disease states that they are already in, whereas pediatrics to me felt very much like preventative type medicine, where you're really trying to keep things from happening down the road. And that was much more of my focus and where I wanted to be. So that's why I chose kids.
Awesome. And Lindsay, do you see patients on a day-to-day basis, or do you oversee the facility?
I oversee the facility. I've held many roles in the facility. I've been a floor nurse and an ICU nurse and a supervisor where I have taken care of patients.
Awesome. So we do have a question in the chat. Just how many patients do you see in a day, maybe at the pediatric office, Dr. Lively, on a typical day?
It very much depends. So particularly with COVID ongoing, so we see some families have been hesitant to come in and do the checks that they might otherwise. So on a non-COVID time, you might see anywhere from maybe as few as 7 to as many as 15 or 18 in a morning. And then the afternoon would be about that same load. And it depends on the situations that we're in, particularly the time of year. So now we're coming into influenza season along with COVID. So certainly our numbers are higher then. So it kind of depends.
Yeah. And then Lindsay, when you were on the floor as a nurse, how many did you see in a typical day?
Typically the patient loads for a nurse is 5 to 6 patients to one nurse.
Okay. All right, we have another great question. Do you still feel as passionate now for your career as you did when you started? It's a great question.
Is that for either of us or for
both of you? We can start with you, Dr. Lively.
Absolutely. I mean, I tell people all the time, I'm like, make sure that you truly check out all the different, if you're choosing medicine, check out all the different specialties, find that place where your heart is always going to feel joy, because there's going to be rough days. But for sure, the kids that I see going into patient rooms, interacting with families, they absolutely make it worth it every single day. So yes, absolutely.
And Lindsay, are you still as passionate today as you were when you started out as that CNA with your associate's degree out of college?
I would say even more so. I think the more you see and the more you're exposed to and the more patients and families that you speak to, I think that just grows over the years. So absolutely.
Great. And we have a question for both of you. And I know you talked briefly about both of this. Dr. Lively, you said you went to school for 6 years. You did a 6-year med plan.
I did, yes.
So that was your college experience. And about how long did it take you to become a doctor after you started college?
So when you go into the combined 6-year program, you are a doctor on day number 1. So I left high school and became a doctor. So we got to see patients. We walked into patient rooms. We had that exposure from day 1, and it's unbelievably stressful at the moment, because you're thinking, I just graduated from high school, I shouldn't be doing this, but it's also unbelievably rewarding and such a unique opportunity. So the 6-year programs really get you in there alongside patient, and you're not caring for patients at that point, but you're inside those rooms with other physicians and learning from day one, which is amazing. It was wonderful.
Is that a typical college experience, the 6-year program, or is that something unique to UMKC that you experienced?
It is unique to UMKC.
Okay.
So typically people will do a 4-year undergraduate degree and then go into a 4-year medical school. The one advantage, well, there's different advantages, but many people will say that going into the 6-year program, you don't have to take a medical school entrance exam, which is called the MCAT, which a lot of people talk about. And so once you're accepted to UMKC, you are in med school. That's it. So.
Awesome. And we have a couple questions that where did you go to school? And she attended UMKC. Just for all of you guys. We have over 100, like we said, on this, and we actually maxed out. We had other people trying to get on the call. So we're going to have a lot of questions coming in. So I'm going to keep spitting them at you. Lindsay, for you, we had a question specifically for someone that wants to just go in the medical field, but they're not 100% sure what they want to end up doing. Do you have any advice for them on kind of how you took your path and you ultimately ended up where you were?
I would highly suggest becoming a CNA. Usually they're typically about a 6-week program. That gives you kind of the foundation and gets you immersed into the patient care world. And then you can kind of find what your joy is or what kind of patients you really like taking care of. So that would be my advice.
Awesome. Thank you. This is for both of you. Do you have, just without obviously talking about confidentiality and the HIPAA rules, do you have a patient that's just really touched you or one that's just memorable, that's something that's happened that you will always remember? Lindsay, we can start with you.
I remember when I was a new grad RN and I had started at another Kindred facility. I took care of a lady who was kind of difficult for a lot of the nurses. Her and I clicked for some reason. She was there for a really long time. She was on a trach and a ventilator. She was a fairly young woman. So her and she knitted me a scarf for Christmas. We sang together. I remember really getting along really well with her, and that early on in my career, that's always stuck with me, and I've always remembered her from there on out.
Awesome. Dr. Lively?
Gosh, it's hard to narrow down just one. I mean, I have so many patients that I remember over the years. I think particularly I have a couple that when I was back in residency at Children's Mercy Hospital and I was doing through hematology oncology, there were a couple of children who have since succumbed to their cancers. But the interactions that I had with them and the moments where, on a day where you could be just bogged down with sadness and grief and that you were dealing with children, and we ended up with having water gun fights with syringes in the hospital. So, it's just the joy of life that can still be seen in those children's eyes and how you learn to appreciate every single moment from them.
That's awesome. What does a typical work day look like for both of you? Lindsay, we can start with you.
I don't think there is such a thing as a typical work day in
Right.
our field or as a nurse on the floor or an ICU or wherever. There's nothing typical, but that's why I like it. I like the unknown. I've always liked that. Typically, I start my day. I try to hit both shifts, both night shift and day shift. So I come in around 7:30, so I can talk to both of them, and then typically about 5 o'clock, sometimes later for staff meetings and things like that.
So for me, also typical has, I don't know, I've lost typical somewhere along the way, but so I do part-time pediatric work. So I actually do 1 day in the clinic a week. So I'm in there on Tuesdays. The other days of the week, I am either full-time mom and homemaker, or I am substitute teaching. So I went back and got my substitute teacher license. So I do substitute teaching in Liberty Public Schools, just because I had not enough stuff going on. So, but typical days for me for clinic work would be that we start our clinic usually at 9, but I'll leave the house here after getting my 2 children now onto virtual learning. So my day starts at 5, so I can get up, get them going. I leave the house usually by 8:30, get to the clinic. Clinic will run anywhere from 9 to shorter days, so I can be home for the kids after school. So I'll do between 3:30 and 4 is when I'll finish, and then come home. But then, the part of healthcare too is for me, you don't come home and everything's done. So then it's answering phone calls, or it's answering social media questions, or whatever it may be. But that's kind of a picture of it.
Great, thank you. Sounds like very busy days, and thank you for subbing. We appreciate that. We need them all the time, so that is wonderful. This is a great question from a student. What has your job taught you about life, and how has it helped you grow as a person and as a professional? Great question. Lindsay, you want to start?
I think one of the biggest things, I was kind of reserved. I didn't really know how to be very assertive when I was younger, speak up for myself. And I think the more you're immersed in this kind of world, you learn as you get older that you just need to speak up for yourself. You need to stand up for what's right. I think that's one of the biggest things that I've learned in this profession.
Great.
Yeah, I think what I have learned is, sometimes when you start out as a high school student or even a college student, you think, well, how am I going to go out and save the world? And that's not a wrong approach to take. But I think through the years, having the opportunity to do what I do, you realize that you can change the world in very small ways, but those small ways radiate out into bigger and bigger circles. So it's amazing sometimes that the things that you don't really think about that you've done that seem kind of small, or I just did them because, and yet somewhere down the road, you find out, you go, wow, that was really cool to see how it came back and fed and did so many other things for other people. So realizing that you can make a really big impact in a small way, just right where you are doing what you love.
We have a question on starting salaries, maybe for nurses, just an approximate salary for nurses, and then also for pediatricians.
Typically, brand new nurses can make upper 20s an hour, 27, 28, 29, somewhere in there. But for a career nurse, if you've been at it for a while, you can usually typically make high 30s, low 40s an hour.
So you're talking hourly, not salary, right? Is that correct?
So
okay.
Yes, hourly. Mm-hmm.
Okay, thank you. Dr. Lively?
Gosh, it's going to depend so much. So if you do primary care, typically you're not going to be reimbursed as well as you are if you're going to do specialty care. So, there's always kind of the running joke among my physician friends as far as, hey, you guys should think about because, there's a little bit more money that it's so dependent. So for us in primary care, probably ballparks of $135,000 a year to maybe 150,000, 160,000. But there are other careers out there, which I don't know personally, so I'm not going to guess at their salaries, but I know they do make more than we make. So I can't give you those specific numbers.
Yeah, and speaking of that, there's a question on this specifically dermatology, but since you're a pediatrician, you see patients that come in with all different types of things that maybe you didn't have specialty. How do you deal with that? And what do you do with those patients if you don't know the answer?
Yeah. I think one of the biggest things that you also have to know when you go into medicine is that it will humble you. So you think you know a lot, but every single day that you walk into that office, you will be faced with something where you go, I have no idea. And that's okay. You're not expected to be all knowing, but you should be able to know, where do I go from if so. I'm very honest and forthright with people when I say, you know what, I know a lot of things, but if this is something I don't, then we will find the specialist, or I will find the answer for you. And it's not simply just saying, oh, I'll just send you to another place. Sometimes it's calling that person up, running cases by them so that I can help them as much as possible, as opposed to just kind of punting them through the system to more and more offices.
Great, thank you. And this question is for both of you. It's specifically related to cancer, but with both of you, how do you talk to families about, devastating news, some news that maybe is not going to be perceived as happy? How are you there for those family members, and how do you deal with it with your own mental health after you had to give somebody some sad news? Lindsay?
Sure. It's very delicate. I just always try to put myself in that position of how would I like that to be presented to me. So sitting down with them, eye level, even holding a hand and discussing. I think not being upfront and honest can do a disservice. So I like to be direct and honest, but stick around and answer questions, give them my personal phone number. They can call me if they have questions. Just really trying to put yourself in that scenario. If you've never lost anybody or had any bad news broken to you, you know that that's really impactful. So how you deal with it's really important.
Thank you.
I completely agree with you, Lindsay. I think the most important thing is sitting down, looking them in the eyes, being honest. I too will give people my phone number and say, you know what, call me because what I'm going to say right now, some of it's going to go right over your head. You're not going to remember. So when you get home and you think about it and you don't know, call me and let me know, and we'll talk about it again. I think it's trying to just be a human being and realizing that this is hard things to hear, hard things to say, and being truthful about that too. And say, so sometimes I kind of am self-deprecating, just say, gosh, I don't even know how to say this. I don't know the right words, but I'm just going to tell you what I know. So it's agreeing to walk the journey with that family, with that patient, and just letting them know that you're not here just to deliver some news and move on.
And then on the other side of that, how do you handle that personally when you go home and you've had to deal with so much with patients? How do you handle that at home? Lindsay, we can start with you.
Yeah, there's been many times that I've cried with them.
Yeah.
I don't think if you bottle it up and you don't address it, it's going to be bad as a professional. You just have to acknowledge it and recognize it and go home and cry, or go to your coworkers and let it out, because it will affect you. And if it doesn't, then you're probably not in the right profession.
Yeah. I think my husband and I both are our sounding boards for each other. So we go home and talk through, since we're both, he is also a pediatrician. So we will come home and discuss things that have gone on and help each other work through it. I've taken lots of long walks with headphones on and cried a lot of tears and thrown a lot of rocks into lakes and such, and taken things, just moments where I just need to de-stress and get back to it. But I think realizing too that the honor that it is that you get to do what you do. So it certainly helps alleviate, or not alleviate, but helps lessen some of that when you go, gosh, I do an amazing, I've been given an amazing chance to be where I am. So that certainly helps you kind of temper the emotions that can get to you too.
And this question kind of goes along right with this. What keeps you motivated? And it sounds like you kind of answered that a little bit. Just knowing that you are making that impact and it motivates you to keep going back, even though the days are hard. Do you have anything else to add to that? What the motivation level is and how you stay motivated?
Well, I think for pediatrics, we have a particular advantage in this case because you see the kids from the time they're born till they're getting older. I am now taking care of patients, children that I took care of as babies. And, I go to weddings and they're like, this is my old pediatrician. I go, oh gosh. So, it's a phenomenally rewarding moment when you see a child who's grown up that you've watched from day one and then trust you with their children. That's motivation.
Yeah.
It's just I'd always look at it as a huge honor too. Even if it doesn't turn out the way you think it's going to, and it's maybe the end of life discussions, or that's such a huge honor to be a part of the end of someone's life or the part of somebody's recovery. I've just always thought of it as such an honor, and that's what keeps me going. So.
What is the most challenging part of your job? Dr. Lively.
I would say the times that we live in, honestly, I would say social media is one of the toughest things. It's a blessing and it's a curse. So there's information that gets shared through all kinds of channels now. And some of it is correct information and some of it isn't. And it's so hard to battle that information that isn't correct, because pretty much when it goes out into social media, it becomes truth for some. And so that it can be very challenging to battle that. And it's a unique time.
Yes, it is. Lindsay, anything different?
I would agree with that. One of the more challenging things in our field, I think in medicine or healthcare in general, is family members or patients who are either they're in pain or they're scared, or maybe they've just been in the hospital for a long time. Sometimes they can be kind of disagreeable. So knowing how to get down to the real root of what's going on, of what can I do for you, what's actually going on, is kind of difficult sometimes.
Yeah, I can imagine it is.
This goes along, I'm trying to think, I don't think we really answered this. We talked about when you're delivering bad news, but this question is specific if you've ever lost a patient. How do you deal with the loss and then move on? So it kind of goes along with what we were talking about, the devastating news, but when you actually lose a patient, if you've ever lost one.
I think being in healthcare, it's going to happen. It is part of life. And unfortunately, I've been in attendance and part of families that have lost children, and it's incredibly difficult. It's those moments where even walking those journeys with, and kids that can, say to, I've had kids say to me, you know what, the thing I'm worried most about is my family. I don't know how they're going to do this when I'm gone. And it's just to see their strength and their ability, their courage to move forward. It's just absolutely phenomenal. And I think it's that courage that they display that gets me through it. I mean, they're amazing little beings.
Lindsay?
I think that you'll always remember your first loss. I remember my first loss, my first code. I've worked with babies too. It's really difficult. I think just knowing, like I said, I find it a huge honor to be there at the end of someone's life. And if you can show them dignity through that, you can make an impact in that way. I think you'll never forget. And like you have to talk to your coworkers who are there with you and debrief and just get through it with each other. So.
You guys are making me tear up. All right. Let's see. Dr. Lively, do you ever just want to walk in a room, this is a fun question, and hug every kid that is around? And would you ever want to become a full-time student? I'm wondering if you know this student that's asking these questions.
Well, yes. I mean, it must be somebody who knows me. I am a hugger for sure. So the worst part about COVID has been that I can't hug people. Although I have resorted to keeping a huge blanket in my office, and there are certain cases where people just need to be hugged. So I wrap them up in that blanket, I cover them up, and then I hug them, because that's just, I can't, there's certain situations that I encounter that I can't not do that. So yes, and pre-COVID and post-COVID, I'm going to go back to hugging every kid in that room. And I usually steal the babies when they walk in, and I'm hugging on them, and parents just know that that's who I am. It's the best part of my job.
I agree. What advice do you have for students, Lindsay, going into college? Is there a certain type of advice you would have for them to, when they're going into their studies, or how they study, or what courses to take? Just kind of a general college question.
I think maybe not having expectations might be one of the things for me. If you have a set expectation in your mind of how things are going to be or how they should be, it's probably not going to end up that way. Things will probably be a bit harder than you expect. I'm kind of a lone wolf when it comes to studying and getting through college. So a lot of people like to go in group settings. I always like to do things myself. And then just not being afraid to ask questions. Even as a nurse, I always said the scariest nurse is the one who doesn't ask questions. So if you just make sure to ask the questions, and I think the no expectations really.
Yeah. Anything different, Dr. Lively? For doctors specifically in college?
Yeah, it's, there's a lot of times I talk with students who are saying, well, gosh, I need to make sure I do this. I need to make sure I do this. And I really want to do this. And if there are some people who, like myself, come out and are ready for that 6-year program and know exactly what they want to do. Although there are some people who in that first year or two also decided, you know what, this is not the place for me. And that's okay. So it's okay to not know when you first start out of high school. It's okay to not know. And there's lots of different avenues to get into medicine, whether you start that 4-year undergraduate degree and kind of take some healthcare, classes or courses throughout, or whether you're one of those people that finishes their 4 years, ends up in another another position and then decides, you know what, I think I want to do med school. I've had people do that. So my husband is someone who went through seminary. So he went through undergraduate degree, he went through seminary, and he was watching MASH one night and he said, you know what, I'd like to be a doctor. So he went back and went to med school. So there's all different kinds of ways. My advice for students is never give up. If you figure out what you want to do, whenever that point is in your life, do it. Go for it, make it happen.
Great, thank you. We have the unique nurse and doctor both on the call. How do you all work together? And I know at times with any profession, it's probably difficult. How do you get through those difficult moments between nurses and doctors?
I mean, I would say it's not difficult only because my nurses are, and I call them mine. They're not mine. My goodness, the nurses that work for our office, they are our hands, they are our feet, they are our eyes, they are our ears. They are absolutely essential. So I love every one of them. I respect every one of them. If we did not work together in concert, we could not do what we do. So it is not an us and them. It is absolutely a we, and we work together. So we are one family.
Yeah, communication is the biggest key. You know, if you go into nursing, you'll find physicians or whomever who maybe don't treat you with the best respect or communicate that well with you. As the years go by, you learn your voice. You learn to communicate, and you learn to say what you need to say no matter what. So I think, like she said, you know, communication, just working together, knowing you all have the same end goal. You all want your patients to do well. So knowing that that's your goal makes things work.
Great. Lindsay, there's a question specifically for you. Are you close with your coworkers, and do you ever miss being directly with patients and want to go back?
I may be too close with my coworkers. I'm not sure. That might be a bad thing. We're kind of a small facility, so we are a small family. We know way too much about everyone. All of our staff members too. I round on the floor. We call it a power hour every morning. So I go up and round on all the floors, round on with all the employees. I have a set patient load that I round on too. So I round on them every day. I talk to them and see how things are going. If they have medical questions or concerns, I try to address those for them. I think I'm still really involved with the frontline staff and the patients and try to keep a pulse on what's going on all the time. So I don't really miss it just because I keep myself immersed.
Awesome. Dr. Lively, when you were in med school to become a doctor, was there a certain method you used to study for an exam or the med exam that you have to take and pass?
No, coffee. I did better kind of in a mix of some small group study and then individual. So at UMKC in particular, I know the campus has changed amazingly since but the law school used to have a fantastic library, and I assume it still does, fantastic library that was very quiet and had little cubicles, and that would be where I would find myself many nights studying and listening to classical music and drinking coffee. So it's intense, but it's what I always tell students too is, you know, it takes a lot of hard work. You don't just have to be the top person in your class. You need to work really hard, and everybody does. So it just takes patience, perseverance, and telling yourself, you know what, so there's going to be those moments where you don't do as well as you thought you did, but you just pick yourself up and keep going.
Love it. Thank you. We could continue going on for another couple hours, I assume, because there are so many questions, and students, I am so sorry that we're not going to be able to get to all of them, but there is one that I want to end on. It's just, if you have a quote, do you have any fantastic quote that you would like to tell students, an inspirational quote or something you want them to remember as we end?
Oh gosh, there's so many. You know what? I'll look to you. I have one. I keep quotes up on my wall. Can you guys see the one on my wall?
Mm-hmm.
So this one says, life is not measured by the number of breaths we take, but by the moments that take our breath away. And I'm not really sure how that plays into medicine, but we'll try to tap into it somehow. My advice would just be this. As I said in the beginning, find what you love. If you love taking care of people, if you love medicine, if you love the aspect of, figure out, is it, I want to to be with a family from the moment that that I meet them and go on a journey with them? Or is this someone where you go, I want to be more the person that goes to you for specialties? So take the time to delineate that out. When you're going to school, enjoy every single one of those rotations. Figure out, is this for me? Is it not? And it doesn't make it wrong or right. It's totally your journey. But then also when you come out of it, make your life what you want of it. So people always say, well, how can you possibly do one day a week? And I say, well, you know what? I have the advantage of my husband is a full-time physician. I have the advantage to be part-time. I wanted to spend time with my family, but I also wanted to do some teaching. So I've created what I wanted. And it's possible to do that. You do have to make sacrifices. So you may not live the life of someone who is the ENT and works 7 days a week and all of that, but you choose what you want in life, and it's possible to do those things. So follow your dreams and find joy in life, because it's hard. Work is hard, and you don't want it to be just monotonous and drive you into the ground. So.
Great job. Lindsay, any final thoughts or a quote that you like?
We just have within our team inspirational quotes that we kind of send out every day. The CEO of our company just sent one out today, and this kind of strikes home, especially as you're trying to figure out where you want to go in life. Just that you're enough, I think is one of the biggest things. You're seen, you're valuable, you're capable. I think that we always are too hard on ourselves, and we think we have to conquer the world with, all at once. So just taking that time and giving yourself a little bit of leeway to know that you are valuable and you are enough.
Wonderful. Thank you, ladies, so much. I'm going to turn it back over to Beth.
All right. Unfortunately, we are out of time. Like Natalie said, there's still lots of questions that couldn't be answered, unfortunately. So hopefully we'll get to do this again sometime soon and host more career fairs virtually, hopefully maybe eventually in person. So speaking of that, I do want to remind everyone at home who's been participating that there should be a survey that pops up here when we're finished. If you'll take a couple minutes to fill that in, let us know what you think. I know that some people were even trying to log in and couldn't because our room was maxed out. So this will be posted. All recordings will be posted later, hopefully later tonight or tomorrow. Also, if those of you at home need more information about any of the other sessions that you weren't able to attend, you can go to the NEBA website, which is www.nebaworkskc.org. You'll find all sorts of information. I want to thank our panelists. I'm leaving feeling inspired. I'm sure that everybody at home is as well. So thank you so much for taking the time to help us today.
Thank you.
Thank you for having me.